Hello, and welcome to Better Health. I'm Dr. Bobby Stowe, and this show is about you, the audience, the patient. In the next 30 minutes, we will explore, answer, and hopefully intrigue you to think about alternative methods to help explain and treat medical conditions and to help you achieve and maintain health. In our last show, we discussed the 3 criteria that I use when selecting nutraceuticals that I provide to my patients, family, and friends. If you saw that show, I hope you found it both informative and enlightening, knowing that you can obtain high-quality supplementation at a reasonable price. Due to the high stresses and demands of our lives today, more and more people are finding it very difficult to eat a proper and balanced diet. Therefore, more and more people are turning to supplementation as a way to meet their nutritional needs as they strive to maintain health. Speaking of health, let's define what I believe health really is. Health is not merely the absence of disease, but rather a homeostatic balance of the systems and processes of the body. It is the harmony of the 12 systems in the body that allow the body to function in a healthy manner and hopefully prevent disease. Again, this show is designed for you to be informative, that you might be able to use and better informed about achieving and maintaining your health. Many times there are alternative methods available for a given condition, and it is my desire to inform you about these treatments and therapies as we all seek and strive better health.
We don't just keep Houston relevant, we keep it thriving, turning homegrown talent into a hometown workforce. We are the opportunity that leads to more opportunities. HCC, smart decision.
It's exciting and bold, yet classy and comfortable. It's the Tom Felicia Home Collection that puts the finishing touches to your perfect living environment. James Craig Furnishings in Houston offers the Tom Felicia Home Collection, along with other fashion-forward home furnishings, fit for every lifestyle. They offer the designs you want and the service you deserve. Visit James Craig Furnishings.
Welcome back. Today in the news, we're first going to look at hormone replacement therapy, or HRTs. There was a report just released in the Journal of the National Cancer Institute about a study that demonstrated the dramatic decrease in the use of HRTs and how it coincided with a lower incidence of breast cancer. This study mirrored a similar study that was released here in the U.S. a short time ago. The use of HRTs was once a favored treatment for the symptoms and signs of menopause and has been declining in recent years because it was found that HRT treatments came with an increased risk of breast cancer, stroke, and myocardial infarction. So for any woman listening that is currently taking an HRT, I would encourage you to review this information for yourself and then speak with a medical doctor about these reports and your continual use of the drugs. In another remarkable advancement in research and how the understanding of nutrition truly affects the body, from the Professor Emeritus of Pharmacology and the founding director of the Oxford Project to investigate memory and aging at the University of Oxford in the UK, Professor A. David Smith just released data of a new randomized controlled study of vitamin B supplementation and the effects on the brain atrophy. In the findings, Dr. Smith found that high doses of vitamin Bs, specifically B12, B6, and folic acid, slow the rate of brain atrophy or wasting in elderly people with mild cognitive impairment. The effective dose of vitamin B was high enough to reduce a substance called homocysteine and cause a dramatic effect in the rate of brain atrophy compared to a placebo. The treatment actually reduced the rate of shrinkage by a whopping 53%, which according to Dr. Smith is huge. According to Dr. Smith, homocysteine has been confirmed as a risk factor for brain atrophy as well as cognitive impairment and dementia. Even in healthy elderly individuals, the brain shrinks at approximately 0.5% a year. But in those with Alzheimer's disease, the rate can accelerate to approximately 2.5% per year. And for those who think that the RDA, or the recommended daily allowances set by the federal government, will keep them safe from these mental challenges, the dose of B12 that Dr. Smith used was 300 times greater than the RDA. The take-home message of this study is real simple. Nutrition plays a huge and significant role in every aspect of our health, and the better we eat, the better our bodies will respond and protect us. We're going to take a short break, but when we return, I'm going to explain and demonstrate some of what chiropractic is all about. And just as there are many types of medical doctors, so too are there many types of doctors of chiropractic. So I will be speaking and showing you the way that I and a number of my professional colleagues practice the art and science of chiropractic, all with one goal in mind, and that is to provide you, the patient, with the best care possible. So stay tuned.
HCC doesn't just provide a college education and career training. We prepare students to succeed in a global environment. We are the opportunity that leads to more opportunities. HCC. Smart decision.
Welcome back to Better Health. I'm Dr. Stowe. In an effort to get you better acquainted with chiropractic, I first thought I would explain to you the process and the education that someone would go through in order to be trained as a doctor of chiropractic, or DC for short. There are over 20 colleges and universities that offer degrees to become a DC in the US and Canada, and most require a 4-year undergraduate college degree to enter the doctorate program. All have stringent requirements and prerequisites that include biology, general chemistry, organic chemistry, physics, psychology, the social science, humanities, and other general studies. Once accepted into the Doctor of Chiropractic program, the classes are similar in nature and intensity as those that would be taken by a 4-year medical school student. However, most of the colleges and universities offering a DC degree operate on a trimester basis and allows the chiropractic student to finish in about 3 to 3.5 years. After the sampling of classes the person would take would include gross anatomy with dissection, embryology, biochemistry, spinal biomechanics, general and psychological, pathological microbiology, neurology, radiology, toxicology, pharmacology, orthopedics, nutrition, internal diagnosis, and that just names a few. Once a person has successfully completed their chiropractic education, now the fun really begins. At this point, each person wishing to practice as a DC will have to take 4 separate national board examinations that almost every state in the union requires. Each of these 4 national examinations have multiple parts that have to be successfully passed in order to take a state-specific examination about the rules and regulations of that particular state that the new doctor wishes to practice in. It is only after the successful completion of 4 national exams, the state exam, can a DC practice the art and science of healing as a doctor of chiropractic. Oh, and I should mention that DCs carry malpractice insurance just as any other medical professional might carry. What happens next to the new DC depends on which specialty, if any, they wish to practice in. Some continue their studies in neurology, radiology, or nutrition. Some go into a sports program, and still others simply go out and start treating patients. The point I'd like to make is that just as with medical doctors, DCs can specialize in a variety of fields and have a variety of areas, all in an effort to assist their patients with a variety of health issues. Now what I'd like to do is show some of the methods in which a chiropractor might treat a patient. For this, I'd like to introduce Tony. And Tony has been a patient of mine for a few weeks now. And Tony, tell us a little bit about what happened and what you came in with.
Well, basically, I was typing so much that, especially, well, both the hands, but this hand, the muscle in here was so tight I couldn't hardly squeeze it at all.
Okay. So I noticed that you have braces on both hands, so you were doing a lot of typing. I believe you were working on your doctorate dissertation
Yes.
for months and years.
Yes.
And so these came from a medical doctor.
Yes.
And what did he tell you had?
Well, he said I had a trigger finger, is what he calls it.
Okay.
And which I do, because it kind of pops. But he said to put these on and to try not to use it as much as possible, and eventually it'll go away.
And how practical is that for you, not using your thumbs?
It doesn't work very well.
Not very well at all. Okay. So what's happened is Tony told me about these conditions, and I examined her, and I found that even though her pain was down here in the thumb, the fat part of her thumb, the cause of the pain was truly up in here. What happens with the thumb and the rest of the fingers is the muscles here in your forearm control them. And I don't know if you can see it, but as I move my hands, you can see muscles here working. So what I determined was that she had an overuse syndrome, and even though the cause was here, the pain was down here. So if you'll take this one off, what I had done was treat Tony with a technique called Graston. Graston are a specific set of tools. There's about 7 of them. They're surgical stainless steel. And what I do is release this muscle up here, these muscles, tendons, ligaments, and the fascia up here in the forearm. I use these tools to assist me to break up these adhesions that have been caused by this constant overuse. So what I'm going to do is demonstrate a little bit about Graston. And the reason I put on gloves is so that I can hold the instruments better. It's nothing to do with being sterile or anything like that. I use a little bit of salve. It's just to keep the skin from chafing, so that as I rub my instruments over it, over the skin, I don't hurt her any more than what she already is. Notice that I'm not touching this, which is where her pain is. I'm going to take my first instrument, and basically I'm going to scan. Just relax there. And I'm running down the muscles, and I can see, if you can see right there, there's a little muscle break. And I'm scanning down there. And when I first started working on Tony, as I was doing this, part of it would be smooth, and then there would be all of a sudden bump, 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 bump. Yeah? Mm-hmm. And what did that feel like?
It hurt.
It hurt. So we take the Graston, and there's one right there. You won't be able to see it, but I can feel it on the tools. And it's smooth, smooth, and all of a sudden, and if you'll notice, you can see it, there's a little bit of redness coming up there. And that's where the adhesions and the problems with the muscles are. Come on down here. Then I turn it around and come up this way. And this is not going to be a treatment. This is going to be just a demonstration of what was going on. But I work on that. And then while I'm doing that, I've got different tools. Come over here, take another tool, and I can actually separate the different muscle fibers. Another thing I would do is have Tony move her wrist back and forth. So go ahead and do that. And as she's doing that, not quite so fast, then that allows the motion of the muscles, that is how the muscles are working, and I can actually get deeper into and separate the muscle fibers. You can relax now. Why is that important? The problem with the thumb that she was having the pain in came from here. The muscles were too short. They were holding back the actual motion. So think of anything you want to use. If you have a rubber band and it's tied in a knot, it won't function properly. If you have a shoestring. The whole idea is that these muscles weren't functioning properly, and the one that was tied to the thumb was causing a reduction in the motion, but every time she tried to use it, it was like chafing. So there's also something else in here called fascia. Fascia is like the Teflon coating of a pan. If it's coated real well with Teflon, it smoothly glides. Fascia does the same thing in the body. So what was happening is this fascia was damaged, again from the overuse syndrome, and it had caused adhesions that were causing it to stick. The Graston breaks it up. We go over this, and again, for demonstration purposes, I'm not going real deep or anything, but I break up those adhesions so that instead of the adhesions being like this and interlocking on the muscle and the fascia, I break them apart. Now they can glide smoothly. Then what I had Tony do was to do exercises and stretches after I did the Grafton. Demonstrate what I had you do, if you will. Basically, when she's doing this, as the process of the healing occurs in the body, what's happening is when you do these stretches, they allow for the continued reduction of the healing process so that the muscles can heal properly in their plane that they need to work in. What I'm going to demonstrate now, I'm using this little cleaner to get the salve off, because I'm going to demonstrate kinesiotape. And kinesiotape, while we're doing the kinesiotape, I'd like to have an assistant come in. The other technique that I use a lot in my practice is called cold laser. So if you'll come in, she's going to put the cold laser on while I'm doing the kinesiotape. Cold laser, put it right here. All right, down. Cold laser is used, it's an FDA approved device. The Food and Drug Administration has approved this device to heal tissue. And you've probably never heard that before, an actual device that heals tissue. And cold laser is used in my office a lot so that I can work with the patient, and while I'm doing other work, this device, which I have on a stand at the clinic, heals the tissue while I'm working on it. So she's going to do that for a minute, and what I'm going to do is grab some kinesiotape. 2008 Summer Olympics, if any of you saw them, there was a young lady there, 2-woman beach volleyball, the tall blonde. She had this tape all over her shoulder, kinesiotape. Kinesiotape is a product that's been used for about 15 or 20 years, and the whole idea behind it is to help assist in the healing process. How does it work? Basically, I can put this on in numerous positions and ways, and it helps. What I'm going to use it for Tony is to help relax the muscle. By helping to relax the muscle, it doesn't work as much. When it doesn't work that hard, it's more relaxed, it heals better. So what I'm going to do is very quickly just put this on Tony. I'm going to basically put it on right there. Now, you can buy this, anyone can buy this, but it's the technique of putting it on that makes it so special. And I'm going to put it on in a way that's going to help relax the muscle. And you think, well, how can tape do this? How can tape do something like this? And it's very simple. The way you put it on is the way it's going to affect the muscle and the fascia underneath. Now again, for demonstrations, great, thank you very much. For demonstrations, there's more to it than that, but what I'm going to do is just showing you that kinesiotape works to help muscles repair themselves. This can stay on anywhere from 24 hours to 6 or 7 days. Okay, what we're going to do now is Tony's going to leave us, and we're going to bring in another assistant. I'm going to show you a couple of other different things. This patient came in some time ago with low back pain that she'd been dealing with for quite some time. And she'd been to numerous doctors, and they had all diagnosed her with different things. And what I found on my examination was a muscle that actually connects from her back, her low back, comes down through the side and connects into her groin. And that's one of the things she said, kind of just as a nonchalant comment. She goes, you know, my back's really hurting, but every once in a while I get a pain in my groin. Well, there's pretty much only one muscle that connects the two, and it's called the iliopsoas. And to get to the iliopsoas, you come along the pelvis here, and I found that she had extreme tenderness and it was tight. So positional release allows me to come in here, find the muscle, and she had a lot of pain while I was palpating that. I come up here and grab, let it relax, and I move the muscle into a position. She would have a lot of pain, and then I'd bring it up here, and all of a sudden she'd be without any pain. After a few seconds of holding this in position, I would let it down and massage it to help get some blood flow back into the tight muscle, because what I'm doing is making the muscle relax. And if you think about it, as I'm relaxing the muscle, because it's connected to the low back, that relaxes and allows the spine to then go back into normal position. Most back pain is caused by pressure from the vertebrae, that is the bones, on the nerve. So if this muscle is here and it's pulling on the spine, it's going to hit the nerve. So a few treatments in one session. So she came into the clinic one time and a few sessions, and the pain was pretty much gone. Now, I would do this on both sides because typically the body it'll show you pain on one, but there are many times when it's actually occurring on both sides. So I do left and then I do right, and I go back and forth, and before you know it, that starts to loosen up, and that relaxes the spine, and that takes away a lot of the pain. Then what I would do is adjust this patient, because as the muscles pull, not only do they torque the spine, but the muscles are also connected to the pelvis. And what happens is you get a pelvic shift that will actually lock in. And you think, well, how can that happen? And it's primarily because you're looking at a pelvis with a bunch of muscles and ligaments, and those muscles get tight, they actually hold a bone in place. This is something the chiropractors absolutely believe in. Now, it's not everything, but if you don't realign the spine, then you're leaving the pressure on the nerves. So what I'm going to do with Charlotte is I'm going to adjust her entire spine. I'm not going to do everything I would do, but I'm going to look at one adjustment on her pelvis, and then the middle part up here, which is called the thoracic, and then I'm going to do her neck. So we're going to put her in what's called a side posture, and if you'll roll over on your side toward me. This is putting her into position so that I can make the adjustment. When she gets in this position, I'm ready to make the adjustment, but it's a small movement. People have always heard from chiropractors that chiropractors cause pain, and they can hurt you or break bones or what have you. Once a patient's in position, the motion to make that adjustment is very tiny, as you will see for yourself. So I find where I'm going to adjust, and I come over here, and this is my position, and that was the adjustment. It's very quick, very simple. It doesn't take a lot of effort. You're not going to see an Arnold Schwarzenegger move and heads rip off and all those kind of things. It's very controlled. It's high velocity in a controlled place. So now she's going to go back onto her back. Normally in the office, I would do the other side. Now what I'm going to do is a thoracic adjustment. And why would I do that? The spine is connected. It's one long vertebrae. If something below or above is out of place, the middle segment will be out of place also. Charlotte actually gets adjusted quite often, and there's one move, this move I'm getting ready to do, that she really likes because it helps open up the passages to the organs. If you think about it, all of your organs are connected to the nerves, nerves to the spinal cord to the brain. This particular move allows those nerves to flow and get the control from the brain. I cross her arms. The area of the bone that needs to be adjusted. Her back, come over here, and that was the adjustment. It happens just like that. Very quickly, I want to explain, I don't know if you could hear the popping or the cracking when I made the adjustment, and I explained this in another show. All we're doing is releasing gas that is around the bones themselves in the joints. So to finish the process, we're going to come up here to the neck, and we're going to position the neck, and again, everything is very smooth, gentle, no quick or hard turns. We're going to find the segment that needs to be adjusted. I'm going to position the neck in a way to get the most relief, and I'm going to make an adjustment like that. And that was the adjustment. It doesn't hurt. Sometimes you hear the gas release. It's called inaudible. Sometimes you don't. But the point is that now the spine is in alignment, and that takes the pressure off the nerves. Charlotte, did that hurt at all?
No.
No. There was no pain involved. So I hope you've enjoyed this part of the program. For me, this is the part of the profession that I love the most. Treating patients and helping them not only feel better, but allowing them to return to health and a better state of health. As I stated earlier, there are a wide variety of treatment plans, options, and techniques that can be used to treat a patient. As the treating doctor, it is my job to determine which of these options are most appropriate for a particular patient. and then to implement that plan in an efficient and effective manner in order to assist the patient back to better health. There's one more segment of the program, and it's called Ask the Doctor. This is where you, the viewing audience, ask me questions. So let's take one more quick break, and we'll be right back.
Whatever your dreams, HCC can make them reality. College classes, extra training, a new career. Be whatever you want to be. From HCC, you can go anywhere. HCC. Smart decision.
Welcome back. We received several questions about our last show on nutritional supplementation, and most of them asked the same thing. Where can I find quality supplements that met the criteria I described in that show? While the question is straightforward, the answer is not so easy. Because my criteria is fairly stringent, there are only a few companies that really meet all three of them. What I'd probably recommend is to first visit a place where you currently purchase your supplements and ask them if they have supplements that you're currently taking or even that they sell that meet any of my criteria. Remember, those criteria were GMP, bioavailability studies, and third-party assays. If you don't know or they don't know, they should be able to find out. If that doesn't provide you with enough answers, you might have to call the company or visit their website and find out if they can tell you anything. Another way is to find a doctor in your area of town that offers supplements, call them and ask them how do they determine what supplements they carry and the criteria they use in selecting the products that they recommend to their patients. If those answers aren't satisfactory, then please email me and I'll do what I can to assist you and get you the quality supplementations that you need. Well, this is the end of the episode of Better Health. I hope you've enjoyed the show. It is my desire to help educate individuals about a variety of conditions and treatment options that exist outside of conventional medicine. I should also state that in no way am I making any diagnosis for any condition. All the comments on the show are for informational purposes only. Any condition that you have or think you might have should be discussed with a qualified healthcare professional. In our next show, we're going to be doing something completely different than anything we've done so far on Better Health. What I'm going to discuss and demonstrate is how exercise at any age can have a tremendous value on the age-old quest to live long and healthy and a productive life. We're going to be going to a local gym and listening and learning about the benefits of lifting weights and exercise. That promised to be very informative and one I hope you won't miss. Again, I encourage you to send me any questions you might have regarding today's topic or any other health-related topics that you might have. Just send me an email to hcctv@hccs.edu, and as time permits, I'll answer those questions on air. Until our next show, take care, enjoy life, and live healthy.